Today, we will be going over the muscle involvement that takes place within the passing of a volleyball. There's a great amount of muscle involvement that takes place within every step of this athletic movement, all which begins with the ready stance.
The trapezius, starting at the base of the occipital bone and spines of the cervical and thoracic vertebrae, and ending at the clavicle, spine of the scapula, and acromion process, help to keep the back straight by rotating the scapula back as well as the rhomboid major and minor. The biceps brachii attaches to the coracoid process, the tubercle of the humerus, and the glenoid cavity of the scapula. It runs to the radial tuberosity of the radius. It, along with the brachialis and brachioradialis, assists with lateral rotation of the arm and flexion of the elbow. Flexor carpi radialis begins at the medial epicondyle of the humerus and goes to the base of the second and third metacarpals. It helps to flex the wrist. Extensor indicus and extensor digitorum allow the fingers to extend. The biceps femoris allows the squatting position to be achieved. The soleus and gastrocnemius, starting at the condyle of the femur, going to the posterior surface of the calcaneus, allows the foot and ankle to be in plantar flexion.
Next, we have the passing position as it pertains to the transition between the ready stance and the pass position.
Serratus anterior starts on the outer surface of the upper ribs and connects to the ventral surface of the scapula. It allows the shoulder and scapula to rotate forward. The deltoid and pectoralis major muscles pull the arm upwards in extension. Triceps brachii extends the elbow. It starts at the tubercle below the glenoid cavity and lateral and medial surface of the humerus and ends at the olecranon process of the ulna. The supinator and brachioradialis also assists in flexion and extension of the forearm. Digitorum profundus, starting at the medial epicondyle of the humerus and ending at the base of the second and third metacarpals, allows the hand to close. The flexor digitorum superficialis and flexor pollicis longus assists in flexing the fingers. Tendinosus starts at the ischial tuberosity and goes to the medial surface of the tibia. It allows the knee to be flexed and the thigh to be extended. The soleus and adductor brachius are also involved.
Lastly, we have the follow-through that comes when impact is made with the ball. The latissimus dorsi is prominent in this position, beginning at the spines of the sacral, lumbar, and lower thoracic vertebrae. It ends at the intertubercle groove of the humerus. It extends the arms and pulls the shoulders down and back. The trapezius and teres major assist as well. The supinator begins at the lateral epicondyle of the humerus and attaches onto the lateral side of the proximal one-third of the radius. It allows the forearm and hand to be supinated. The triceps brachii and brachioradialis also help. Flexor digitorum superficialis allows the fingers and the wrists to be flexed. It starts at the medial epicondyle of the humerus and the coracoid process of the ulna and goes to the tendons of the fingers. The flexor pollicis longus and flexor digitorum allows flexion of the fingers. The soleus and gastrocnemius allow plantar flexion of the foot to be achieved. The vastus lateralis allows the knees to extend. It starts at the greater trochanter and posterior surface of the femur. It attaches to the patella by the tendon and the tibial tuberosity.